practicing active listening. And that is something which I feel is very, very, very important. This is active listening is, let me start off by saying this, okay, that as a general rule, if you can try to do this, to put that into practice from the very beginning, that will really help. That in the first 5 minutes after you have introduced yourself, obviously you have introduced yourself, you have gone in the room, you have said, okay, my name is Dr. Sanjiv Pathak. Today I'm here to help you with your concerns. Let's talk about this. And then after that, there is a 5-minute rule where it's extremely important that you do not talk. You let the patient talk in that time and you do not interrupt the patient. And if they were to say, for example, for any reason they were to stop, like as I said, it's not that all patients are willing to talk, all patients are wanting to discuss all of that. You need to give them little prompts. You need to ask more about them, and you just need to be actively engaged in that conversation, but more towards the listening side of things, not so much so about advising or replying. A lot of people listen to things to reply or to advise. This is where the problem starts to happen. The purpose is not to give, you have to genuinely try to listen to them, because when you are actually listening to them, at the end of the conversation, they feel like you have been listening to them. They have to feel heard. It is not important that you are just listening to their words. What is very important is to understand the meaning behind those words. Okay? So that makes it very important in the whole process of active listening. Okay? So your body language is very important in terms of when you are doing the active listening. You have to, instead of using prefabricated words like that is a very good question or that brings us to a very important point, sometimes it is even more important to just use fillers like okay, all right. So this is not interrupting them while they are talking. It is actually telling them that you are actively listening to the patient. Okay? Because not everyone is ready to say everything right in the beginning. Everyone prepares themselves, or almost everyone prepares themselves before coming to a doctor or a dentist, right? So what they will do is they will in the beginning share with you something that they are comfortable sharing with you. It is only when you make them comfortable and you have built up the rapport and the patient feels confident that now they can share their problem with them is when you are uncovering the deeper issues. And that is where you have to really know about, because if you cannot fix the deeper issue and if you are simply fixing something which is very superficial, then it is not going to get you the outcome that you are after. All right. So that's very important. In the process of the active listening, I will like to give you some pointers here. It's very important that you are actually paraphrasing and summarizing what they are saying. So that always helps, because first, very importantly, what it does is it clarifies the thing. Because if, say, for example, if someone has said that, okay, I have been up all night with this toothache, if you say it back to them in terms of saying that if I'm getting it right, this tooth was the one that kept you awake and this has been hurting all night. What you have confirmed is that it is the right tooth and that what you heard was right. So it's very important that you are actually paraphrasing and summarizing the whole thing. Mindfulness is very important. The second one, which is very important. So like as I said, paraphrasing and summarizing. The next is mindfulness. That is actually being in the moment. Don't try to jump to the conclusion, because sometimes when you try to jump to the conclusion, then you are actually missing out on the real issue. So mindfulness, being in the moment and understanding and listening to what they are saying. And this is very important, look, you can practice as much as you want to, but when there is actually a real patient in front of you, you can be dealing with a different situation. So sometimes what happens is that not all patients are actually able to communicate that well to you. So if you feel that they are actually struggling with something, what you can do is you can provide them active leads, which means that you can actually be saying something like, that is, so say for example, they said that the tooth has been hurting all night. So you can actually guide the conversation in the way that, oh, has it been doing that for the last few nights? Or was it the first time that happened last night? Was it a dull throb, or it was a sharp pain? Was it actually hurting more when you were lying back? So you can give them little prompts, but try to keep the questions open-ended. So when they have talked about a problem, always try to elaborate that more by saying, do you want to tell me a little bit more about it so that I can help you better? Now, this is something that I will keep talking about every time. You have to always attach a reason to why you are asking someone for this. And I've told this before as well. And that essentially starts from the time the patient sits in the chair, once you start looking in their mouth, anything. You put a bib around the patient, you give them glasses to wear, you always tell them a reason. There is a way where you can actually give the patients glasses to wear. Alternatively, you can give them the glasses and say, hey, I'm giving you these glasses, please put it on. This will avoid the glare of the bright light. Or I'm going to put the bib around you. This will help with any spillage if it was to happen. And it will not ruin your beautiful dress or your wonderful suit or whatever. You have to give them the reason, because this is something that you have to practice in day-to-day life. It's not just about clinical science. For any person you are talking to, if you actually give them the reason for why you are doing it, and I will be talking about this in greater details later on with the why, because the why is very, very important. All during that active listening phase, you are maintaining your body language in such a way that people can relate to you much better.